monitor the numbers, and as we have done throughout this ordeal of the last year and a half, we will base our decisions on public health, medicine, and the sciences, and balancing that and trying to keep our economy going. So with that, I'm going to turn it over to Commissioner Helen Calton Harris for her update, and then we will go to Patrick Sullivan on what is being done with the buildings, and we will close with a really important topic on reassuring our parents and guardians, our students, our staff about getting back to school. We're going to have our kids back to school and fully, and we also, Superintendent will speak that we've also be offering a virtual type school too, first of its kind on that. So without further ado, the Health and Human Services Commissioner of the City of Springfield, Helen Calton Harris.
Thank you, Mayor. And as always, thank you for your support. On Friday, August 13th, the Centers for Disease Control and Prevention recommended a third dose of Moderna or Pfizer vaccine for certain individuals. People who are moderately or severely immune compromised are more likely to have serious disease with the COVID-19 and are less likely to develop adequate immunity. And so the recent data suggests that individuals may get protection from a third dose. And so it's very important that we know who these individuals are that we are recommending for a third dose. Active cancer treatment for tumors or cancers of the blood, those individuals. Organ transplants and are taking medication to suppress the immune system, those individuals. Stem cell transplants within the last 2 years are taking are taking medicine to suppress the immune system. Moderate or severe primary immune deficiency is important as well. Advanced or untreated HIV infection, active treatment with high dose or other drugs that may suppress the immune system. The reason I'm bringing this to you is because it's very important for our residents to understand if they have any of these conditions, it is critical that you contact your primary care physician. We are recommending that primary care physicians be the individuals who will tell you, based on what they know about you, to go and get that third dose. So the third dose is something I'm going to ask individuals to go to their primary care physician for. If your primary care physician says we would like it to the health department to do it, we will certainly do it, but I'm asking everyone to get clearance from a primary care physician before we give that third dose. Boosters have not been recommended yet, so we do know that there is going to be boosters that are going to be necessary, but we don't have a timeline for that yet. I am actually thinking it may be around October or so, because the earliest individuals that got vaccinated in December. And then we went to the long-term care facilities. Now, I'm going to assume that we will do that kind of outreach, so that we are going to the long-term care facilities first and providing boosters. So this is not what I'm talking about right now. This is for individuals with severe immune compromise. Johnson & Johnson, this is for Moderna, and this is for Pfizer. Johnson & Johnson, there has been no recommendation for a second dose for Johnson & Johnson yet. I'm assuming that at some point they will come out with that. A memo went to all healthcare providers, and it did outline some steps for the healthcare providers when they're doing the assessment as far as who is going to need the booster is concerned. So please, if any one of those immune compromised that I just mentioned, if that you see yourself in that, please contact your primary care physician. And again, we have no problem giving the immunization. We just want to make sure that the primary care physician has been contacted. In the Commonwealth of Massachusetts, we've had 4,438,499 individuals vaccinated. This report is from August the 19th. I'm going to read you some vaccination data for the city of Springfield, and you'll know why we think it's important, the mayor and I, to stand up the youth task force. And so 53% of Springfield individuals have received 1 dose. 46% are fully vaccinated. That is well under the around 70% that we see fully vaccinated in the Commonwealth. In the city of Springfield, 12 to 15 years old, 30% are vaccinated. 16 to 19 years old, 33% are vaccinated. 20 to 29-year-old, 32% are vaccinated. Now let me stop there and remind us about that 30 and under age group, which we continue to try to ask to get vaccinated. Their vaccination rates, the highest is 32%. That is extremely low. And so we're going to keep working until we're able to help individuals understand the need for vaccination. And as the mayor mentioned today, Pfizer did come out, the FDA did say that Pfizer vaccine is fully considered to be safe and has gone through all the rigorous process of the FDA. So it's fully able to be used not as a EUA, but as a vaccine that has been approved. We're hopeful that that approval will have some individuals wanting to get the vaccine, and I also think it'll make individuals more comfortable who want to mandate vaccinations because they know it has full authorization. So that might change some individuals' mind, and I'm really hopeful that'll change some individuals' mind in wanting to get vaccinated. The 30 to 49-year-olds, 54% are vaccinated in the city of Springfield. 50 to 64-year-olds, 76% are vaccinated. The 65 to 74-year-olds, 82% are vaccinated, and 75 and over, 77% are fully vaccinated. And so in the Black community, individuals, 41% of individuals in our Black community have had at least 1 dose. In the Hispanic community, that is 35%, 1 dose. White community, 63%, 1 dose. Fully vaccinated, Black community, 35%, Hispanic community, 29%, white community, 57%. And so our ability, we have identified 3 individuals that will meet with the mayor next week for the youth task force. Those 3 individuals will provide the leadership. We should be able to give you those names, hopefully, by the end of this week. But we're excited that these young people want to step up and try to work with their peers to get them vaccinated. Symptoms of the Delta variant. I think one of the things that has changed is that the sneezing and runny nose is associated with the Delta variant. If you remember the Alpha variant, or the first one, it was coughs. It was more a cough. And the what they're seeing is not the same level of coughing that we saw with the Alpha variant, but some symptoms remain the same: runny nose, headache, sneezing, sore throat, loss of smell, and fever. Contact tracing. So because our numbers have gone up, the staff at the Department of Health and Human Services is beginning to ramp up contact tracing again. We have received money from the Commonwealth for 2 years to hire contact tracers that we will have working with us, and we will gear that up soon. That money, or that grant, just came to us a couple of days ago. As the mayor said, unvaccinated individuals are the primary persons that we're seeing in hospitals, and also individuals that I talked about with that immune compromised system. Many of those individuals are in hospitals as well, but we're not seeing individuals who are fully vaccinated getting severe illness and dying. And I think that's what the vaccine was meant to do. It was to keep us safe and to make sure that we didn't have adverse symptoms and did not succumb to COVID-19. I'm going to go briefly through our charts just so you can see. This is just this week. They will be up on the city's website. But I'll start with the days of the week, and as you can see, Sunday 46, Monday 58, Tuesday 26, 93 on Wednesday, 86 on Thursday, 87 on Friday, and 81 on Saturday. The confirmed cases for the week, if you recall, the lowest one was 17 that we had 2 weeks ago. Then we went to 37, and now 64 is the lowest one that you're seeing on this chart. And then the week of July 18th, 119, July 25th, 122. The week of August 1st, 279. The week of August 8th, 374. And this week, 477, which is 103 cases more than we had last week. If you look at the confirmed cases by month, and you can see that in June we had only 153 cases. If you put that in context, that was low. And we then went up to 344 in July, and now, right now, we're at 1,130, which obviously we can see that the numbers for us are going up. If we look at the donut chart with the ages, you still see that that 30 and under group is the group, 54% of the cases, and then when you add the 50 and under group, that is 85% of our cases last week, and that's consistent. The week before, it was 86. The week before that, it was 88. So it's stubbornly stuck as far as, you know, that our younger population is concerned. The zip codes really are, you know, consistent with what we have been seeing. 01109, 114, 01108, 73, 01104, 73. And if you've been following these charts throughout the pandemic, what you know is that those zip codes have continued to be challenging. I want to find the chart that looks at the ages. Maybe I'll just walk over here because I think this is really what is disturbing on some levels. 0 to 10, 81 cases. I've not seen 81 cases in 0 to 10 as long as we have been putting these charts out. That's a lot for a 0 to 10-year-old. And what we know about that population is that they can't be immunized. There is no vaccine for that 0 to 10-year-old age group. But we are seeing the infection in that age group increase. 11 to 20-year-olds, 69. Some of them are eligible to be vaccinated, and we hope to be working with them. And then that 21 to 30, 109, and then 31 to 40, 98. The other trend, I think, is that we have not been seeing older individuals. The 61 to 70, 21 cases. The 71 to 80, 15. The 81 to 94. 91 to 102, and then other 2. And so these individuals in this age group are the ones that may likely end up in the hospital because of the age. And I do not know whether they're vaccinated or unvaccinated at this point. But I think this is just really a snapshot of what I've seen. The mayor and I have been looking at for the last month or two. That younger age group just stubbornly showing up in our numbers. And again, I think by having the youth Vax Force stand up, we're hopeful that we will start a campaign to try and reach our youth. So what's important is COVID-19 is here. It is not at the place where it was some months ago, but it is increasing, and I just want individuals to understand, my staff is going to be calling you for contact tracing. Please make sure that you're giving them all the information that they need in order to keep you and your family safe. Watch your distance, still important, because even though we say to people, when you're outdoors, if you're not vaccinated, wear a face covering, it is on the honor system. We are asking people to be honest with us and let us know about their vaccination status. It's just, we really feel strongly that even when you're outdoors, please make sure that you are taking care of yourself. This virus, and I say it is not a sprint, it's a marathon. I think all of us just have to work together in order to hopefully continue to mitigate this. So make sure that when you are with your family, when you're indoors, when you're around people that you don't know, this virus spreads, I'm told, 1,000 times more than the original one. And so than the alpha one, which is the first one. And so it's important that we do watch out for each other and take care of ourselves. I want to thank Jeannie. I always want to thank the mayor because he supports us in anything that we need, but I really do need to thank Jeannie Clancy and Superintendent Warwick, A.D. Early, as well as Assistant Superintendent Lydia Martinez. I feel like we're family now. We talk so much. I mean, but one of the things I think, Mayor, I can't remember who at the school committee said it, but they said, this city works together. Yes. This city, when who was it? Maria Perez. Yeah, I mean, she was just saying, she's just really happy to be a part of who we are as a city because we work together, and that's very evident by our outcomes, actually. So, thank you, and I'll answer questions after the rest of the presentation.
Thank you, Helen. Always very informative, and appreciate your direct and compassionate message. There's two things here Commissioner Helen Colton has indicated that we need to reinforce. One, this has become a pandemic of the unvaccinated. And two, and we were the first out of the block in consultation with Superintendent Warwick, the masking is an extra layer for our students. You can see there's been a little bit of an uptick, and I don't understand the politics that is being played on the masking. It just makes sense. You continue to monitor the numbers. You continue to get vaccinated, and hopefully they'll have vaccinations for younger children. But in some of the other across the country, even in the area here, there's politics being played. This is about public health and common sense on it. So this should sound the alarm. But if you get vaccinated, you starve the COVID-19. They can't go to the host, being yourself. On it. But the numbers show, and Dr. Kerouac also indicated too from Bay State, the people who are in Bay State currently now, which are all unvaccinated. The last thing I'll say before I bring up Patrick Sullivan is that when we were flying the plane as we were building it, we're in much better shape to deal with this situation, and the ace in the hole is the vaccines. But Helen and I, we're not going to play any politics on this. We'll base the decisions on public health, medicine, and sciences, and then continue the balance, keeping our economy going and working with our business community. With that, I want to bring up the Director of Facilities and Parks, Patrick Sullivan, the Wizard of Oz, done a tremendous job, he and his team, just to reassure the millions and millions of dollars we have put forth to retrofit all our schools and public buildings to the parents, guardians, students, staff, and teachers of our Springfield Public School System. Patrick Sullivan.
Thank you, Mayor. Good afternoon. Our facilities trade staff continues to maintain the $1.5 million in COVID prevention equipment that we installed across the city, both in our school buildings and municipal buildings, and that was completed at the end of last February. This equipment exceeds the CDC guidelines and has brought our buildings to ASHRAE standards. Parents and guardians should take note that the mayor, the superintendent, Helen Colton, our health commissioner, myself, when we met last August to review both CDC guidelines and the DESI standards, we quickly realized we could do better. At that time, they were recommending putting box fans in a window with a filter attached to it. We contracted with Bob Kirchner, an industrial hygienist, and we quickly came up with a very good plan for our citizens, which in classrooms which are older, have these carrier OptiClean units in them, and they clean the air up to 20 micron. And then we also, in our newer buildings, and City Hall is one of the buildings, even though it's an older building, it has a newer HVAC systems, we have the I-Wave. And what the I-Wave does, it electronically charges the particles in the air as it passes through the air system, and it takes that hydrogen molecule out of any virus or bacteria, and that attracts it to the filter. So we have a very high standard in the city of Springfield in fighting this virus. We've also have gotten grants through the MSBA. We're completing upgrades to the heating systems at Sumner Avenue Elementary School, Indian Orchard, and Harris Elementary Schools. So again, parents and guardians should take note that we timely maintain and replace equipment when needed. And then also our facilities division is completing over $5 million in upgrades to our school buildings across the city, and that's thanks to the mayor and the superintendent. These could be anywhere from painting projects to replacing floors to energy upgrades. This is all we feel is another part. When you're putting a new floor system, you're painting walls, there are surfaces that can be cleaned easier, and I think that's all part of fighting this virus. And then last, due to the grants and the cooperation with the MSBA, we're opening a new Brightwood Lincoln School this week, and we've broken ground on the new DeBerry Homer. So again, we're constantly replacing facilities. But we just want everyone to be assured we have attacked this in such a way where we had a family member in each of our buildings, so people should know that we've protected your loved ones and should feel very comfortable coming to work every day and working and learning in this environment. Thank you.
Thank you, Director Sullivan, you and your team for all your great work. Now really the important aspect of this COVID-19 situational update. We're going to bring up Superintendent Dan Warwick and his team and Nurse Jeannie Clancy. They've done a tremendous job really to give you the ins and outs of what specifically is going to happen with the school. So Superintendent Warwick and Nurse Clancy, if you'd like to come up too.
Thank you, Mayor. Good afternoon, everyone. After all you've heard so far today, you can see why I'm thrilled that I'm superintendent of schools here in Springfield. The way this city has responded to this crisis has been incredible, and that's thanks to the leadership of our mayor. It's one city, and our kids were the #1 priority, not politics. And everything has been done since the beginning of the pandemic has been about ensuring a safe environment for our kids and our staff. Our kids are coming back in next week. Our staff is all back this week because we do a week's training before schools open, and I'm thrilled to report that we've done everything humanly possible to make sure that our kids are returning to a safe and healthy environment, our staff. Last year when we talked with Pat Sullivan about how to make sure the buildings would open safely, he came in with an industrial hygienist, and our whole piece was let's exceed the standards, let's make sure we do the right thing. And the mayor stepped forward and funded all of that, over $1 million to make sure all of this is an airborne virus, we wanted to make sure our HVAC systems exceeded all standards, and they do. Since that, every decision's been made again around safety. When Helen spoke to us this summer about a mask mandate, I was absolutely ecstatic that we beat the state out of the box with a mask mandate, because again, I think we conveyed public health is #1, not politics, and our kids are #1. So our kids and staff are going to be safe upon return. Again, the mayor helped us tremendously with all the PPE and cleaning supplies, everything so we could return everyone back into a safe and healthy environment. And because of that, last spring, when we brought our kids back in, minimal problems, really was executed very, very well. Our staff worked so hard to make sure that everything was delivered in a quality manner, in every way to meet our families' needs. And while we were closed, we provided 8.7 million meals to our families to try to deal with the food insecurity in the city. We're going to continue to do that. To our parents, I say that we're going to open those. It's going to be done to make sure everyone's safe. We're going to maintain up to 3 feet distance. Out of an abundance of caution, We're going to serve our meals prepackaged and in the classrooms, our breakfast and lunch. So we're doing everything we can, again, out of an abundance of caution, to make sure that we return our kids. But our kids need to be in school. They need to be in school. This has been a very, very challenging period for our families and our kids, but we know they need to be in school. And the only way we're going to keep them in school is to make sure we do everything humanly possible to continue to operate as a team here in the city of Springfield to ensure the safety of our kids and our staff, and that's number one. Again, thank the mayor for his tremendous support, our school committee, our health commissioner. Helen said it earlier. We talk daily, and she's with us the whole way, and I feel like she's part of our team. Another key member of our team is Jeannie Clancy. Jeannie has just done an absolutely incredible job, and again, working with Helen every day to make sure we had the pool testing set up, the Binex Now testing. We were doing all the contact tracing to make sure, again, that when we bring our kids back in, they're going to be safe. And Jeannie, I just wanted to thank you and open it up for your comments.
Thank you so much. And again, thank you, Helen, for all the support you've given us. I want to let you know that we opened school today with education for all our staff. It was done in each school, and it started with our prevention strategies, and our number one strategy is vaccination. So the first week of school, for any students 12 and over, their consent forms are going home. We also educated on the importance if you're sick, if you're COVID positive, or you're a close contact, that you need to report to your administrator and a nurse will reach out to you. We don't want sick children or staff in school without knowing they've had a COVID test. We also went over the correct use of masks, how to take a mask break. We went over physical distance, as Superintendent Warwick said, and we are working with a new contract for our lab, which is CIC Health, and all those permission slips have been copied and sent to the school, and again, they will be going home the first week of school. And a review of hand hygiene and contact tracing, which the nurses will be doing. And that's basically an overview of what nursing's been doing. Thank you.
Jeannie's done a great job in every way, and another thing she did is working with Big Y for our students 12 and up. We're going to actually do the vaccinations in the school. We need to get those vax rates up. So again, to reiterate, everyone take the vaccine. It's the right thing to do. We're going to have, again, masking in the schools. We've said that from the beginning. So everything possible, but this vaccination piece that Jeannie worked with Big Y, which has been a great corporate citizen here in Springfield, to get that going for our kids. Because as Helen said earlier, those vax rates amongst students at that age and younger people aren't what they need to be. And that's the number one thing we can do to ensure safety. So thank you, Jeannie, and thank you, Helen, and thank you, Mayor.
Thank you, Superintendent Warwick. Thank you, Jeannie. I just also want to point out to Superintendent Warwick and the school committee, this has been a trying time for mental health situations, and the superintendent has put extra emphasis on that in our schools with counselors, mental health counselors, and other aspects to help students deal with this and their families. Last thing I'll say before we take questions, everybody would love to take some questions and clarify things, is that we're also doing wraparound services. I know with the shots, vaccine shots that we were doing, that our student athletes, even the families, if you need that shot, we're giving you that shot too. The more the merrier. So we'll take the whole family. But we wanted to come together. I still hear, and I know Helen does too, from a lot of people that they miss our pressers we did for a year and a half every Monday morning. And we hope we don't have to get to that point in time again, but we felt it was important to give you another situational COVID-19 update, specifically on where there's some red flags and on our schools. So with that, I'll open it up for any questions or comments for myself, or please, Commissioner Helen Carlton-Harris, Director Sullivan, Superintendent Warwick, or Nurse Clancy. Yes, Paul.
For the superintendent.
Sure, Superintendent Warwick. Yeah.
Hi, Paul.
Hi, vaccination rate is among your staff?
I do not, no. Jeannie, do we have any way of ballparking that? You haven't seen that? Right.
Okay. Can you explain?
I would think it's very good from everything I've heard, but we don't have any confirmation of that.
Can you explain how the virtual school works, who that's for? I mean, as I understand it, you're expecting that all students are to be in person 5 days a week. So who's the virtual school for?
So we did an in-district virtual school model for the first time this year. The state opened up the option to large school districts to open up their own virtual school. We thought it was a good idea. We thought we'd have some families reticent to send their students back in live. And a lot of families, more families had been signing up for home instruction. And we thought with home instruction, the kids are missing a lot. We could do a better job if we opened up a virtual school. So with the support of the mayor and the school committee, we're starting up a virtual school. We have about 520 students enrolled, grades K to 12. Most of the other districts in the state weren't able to get this up and going, but we thought it was important for some of our families. So we're going to have it ready to go. Our staff is actually on site getting trained today with everyone else. So it's gone very, very good. It was exceedingly popular, and we have more students than we originally anticipated. We're going to offer a complete curriculum, you know, obviously virtually. We learned a lot. We were out for a year and a half. We learned a lot about remote instruction, so we're going to put that into practice for families who feel that's the right thing for their student. On a personal level, I think the kids need to be back in live, but for families who are uncomfortable with that, we thought we should have another option.
Paul, just to let you know on that, Danny said I was at, no, because I wanted to, right from grassroots, I was at Solid Rock Baptist Church this Saturday at the pancake breakfast. Bishop Curtis Schroeder were doing a backpack giveaway. It was really hard. It was wonderfully done. But I ran into kids there, and what did some kids say? They said, Mayor, I did really, really well virtually from home, and I'm going to be in a virtual school. Then I heard from other kids there saying, we can't wait to get back into school. So I commend the superintendent and the school committee, that option on it. So, and it was, that young lady was really, it was hard. She was, I really thrived working virtually. So she's going to do that. And there's other people there saying, we want to get back to school. Sorry, Superintendent.
Transportation, will there, I know everybody has to wear a mask on a bus. That's a federal regulation. Is there going to be spacing on the buses, windows open again? What's the story of that?
Great question, and what we found there was no transmission on the buses. Once you open the windows on the buses like we were doing, we were cracking all the windows, and with the masks, it's a very safe environment. So we're following that protocol, and that worked really well for us in the spring.
Do you have any issue with availability of bus drivers? We've heard nationally there's a shortage, just like there's a shortage of CDL licensed truckers, there's a shortage of bus drivers. Is that an issue that you?
I mean, there's a shortage in the labor pool in every sector, and we're battling that in every sector. But I believe our routes are out to bid, and it's going in the right direction for us. But it is a battle, Paul. We've been hiring all summer.
Thank you.
Any other questions, the superintendent?
What's the plan for our high school athletes for this upcoming school year?
Great question, Brendan. One of our former students, he always thinks of everything. With the support of our health commissioner, what we did with sports was we reinstated sports right away. Last year we were very successful. Again, following all the protocols, but the most important thing was Helen stepped forward and said, look, before we start each season and during each season, we're going to test all the kids. We brought them together and tested them, and I think that's been the reason for the success of our programs. So our sports programs are up and running, and I'm very confident it's going to work, again, because of the extra caution and the leadership of our health commissioner. Thanks, Brendan.
Any other questions, superintendent?
There's just a follow-up on that. There's been some discussion about requiring student athletes in sports programs to be vaccinated. Is that something that you're considering in?
Well, I'm a big supporter of vaccinations. I haven't seen a requirement come forth yet, so we would certainly look at that. Helen, did you see a requirement on that yet, or Jeannie? It's been talked about, yeah.
Jurisdictions that might be something that's required. So just wondered if that's anything that's it's under consideration at all.
Yeah, certainly I think we would work with our health department if something came out at the state level. I, for one, would absolutely check with Helen and Jeannie first, but I would support that 100%.
Helen, why don't you come up?
Been very consistent in that when we get to mandates, if we get to mandates, then we will move those forward with the support of the superintendent, the school nurses, and the mayor. But right now, there's no mandate for vaccines in school. And I think it's going to be a little difficult. We've got to educate our parents. I think that's one of the things Jeannie does very well in the schools, is educate our parents around the importance of vaccination. Hopefully they get up there without mandates. That would be perfect.
There's been a lot of talk about it. There's been a lot of talk in the media. In fact, the two national presidents, AFT and NEA, both have endorsed vaccination. So it's something that could come down the road.
Thank you, Superintendent.
Any other questions, Superintendent? Thank you, Dan.
Thank you, Mayor.
Any other questions at all?
I think we're all set. Thanks.
Good. Hey, thank you very much. I want to thank, again, the media. You've been great partners. I want to thank my cabinet heads down the rank and file, tested and true through a number of natural man-made disasters. And I want to thank you, the residents and business community of the city of Springfield, for your patience, your cooperation. We will beat this COVID-19. We're giving you just some red flag issues that we need to deal with right now. And again, Helen and I and my whole team will base our decisions on public health, medicine, and the sciences, and common sense, and balance, and keeping our economy going. We won't play any politics with it, and it should be commended that we're all working together here in city government with our partners to make sure you stay safe and sound and healthy. Good health, and God bless. Thank you very much.